there are two kinds of documents which require different procedures when applying changes. In case these changes has to be done in paper-based documents, the original entry has to be crossed out and the corrected entry is added. The corrected entry is dated and marked with the initials of the person who applied the change. Changes that are not self-explanatory need to be extended by a note of explanation. In case these changes have to be done in electronic-based documents, applied changes need to be traceable. The procedure has to be specified by the database system or the sponsor and, of course, need to be established prior to the start of the clinical trial. Moreover, the investigator has to ensure that the data reported in the CRF is correct, complete, and available in time. What exactly in time means should be defined in the protocol, since data that are not available to the sponsor in the study database cannot be evaluated in the sponsor's risk-based quality management. The investigator also needs to make sure that data reported in the CRF is consistent with the source data, and that corrections in the CRF are carried out in compliance with GCP. The trial documents need to be maintained as specified in Chapter 8 of the ICH GCP, dealing with the essential documents for the conduct of a clinical trial, and the applicable national regulatory requirements. Moreover, the investigator has to ensure that the monitor, the auditor, and the inspector of the ethics committee or regulatory authority have direct access to trial-related records upon request, and essential documents such as patient records and study folders are filed as specified in the protocol. The investigator is also responsible for the submission of a written summary about the status of the clinical trial. This summary needs to be submitted to the ethics committee and the sponsor, usually annually, which is specified in the protocol, but it can also be more frequently if requested by the ethics committee. The investigator must promptly provide written reports on changes affecting the conduct of the trial and/or increasing the risk to subjects, to the sponsor and to the ethics committee. Details on this procedure are again specified in the protocol. The subchapter about how to deal with serious adverse events I will skip to, because we will focus on this topic later during this course. The ICH GCP also specifies what the investigator needs to do when the clinical trial is prematurely terminated or suspended for any reason. The investigator needs to immediately inform the trial subjects, assure their appropriate therapy and follow-up, and to inform the regulatory authorities. Who needs to be informed and receive a detailed written explanation depends on the person who decided to terminate the trial. The decision to terminate a trial can be made by the investigator. In this case, the sponsor and ethics committee need to be informed. It can also be made by the sponsor. Then the investigator needs to promptly inform the ethics committee. Or it can be done directly by the ethics committee. In this case, again, the investigator is in the focus and needs to inform the sponsor about the decision of the ethics committee. Of note, sponsor or investigator responsibilities can be delegated by mutual agreement. After completing the trial, the investigator has to provide a summary of the trial's outcome to the ethics committee and the regulatory authorities, and basically to all who have approved the clinical trial prior to its initiation, in accordance with the national regulations. However, this task may be delegated to the sponsor in the trial site agreement. If this responsibility is transferred to the sponsor, this must be documented in the investigator site file. To summarize the fourth chapter of the ICH GCP guideline E6, I would like to highlight that this guideline specifies many responsibilities of the investigator, which can be delegated to qualified staff. However, it is not possible for the investigator to delegate the responsibility for the conduct of the clinical trial. In some countries of the European Union, some tasks of the investigator can only be delegated to physicians according to national regulations. Another important point is that the investigator must oversee the conduct of the entire clinical trial at his or her trial site. Thank you for your interest and attention today.